It is very important in a system that there is an agreed structure, and there must always also be agreement on how the different parts of the structure will function in relation to the others toward accomplishing the objectives and the goals of the system. We can divide the integrated surveillance system into three parts. Note that there may be other subnational levels between the site and the national level, depending on the country. In most cases, there will be the following three main parts of the system. First, there is the site. Then there is a national level, usually the Ministry of Health. And last but not least, the laboratory. The role and the responsibilities of each part are different, and we're going to talk about them now. The Sentinel site's primary role is to identify and sample cases. Its responsibilities include identifying cases that meet the case definitions, including confirming that cases that have been identified by clinicians actually meet the case definition, reporting epidemiological data using the chosen information system, conveying the reports of laboratory testing to the clinician, collecting specimens from cases using appropriate infection control practices, and teaching others to use the appropriate infection control practices in collecting specimens, and finally preparing and shipping specimens to the laboratory under appropriate biosafety conditions. The role of the national level is to coordinate and to disseminate. The responsibilities of this level include the following: collaboration with the lab to conduct surveillance training and awareness activities, and to periodically evaluate SARI ILI surveillance at sites, monitoring the performance of Sentinel surveillance at sites through defined indicators and identifying and resolving problems, promotion of integrated work between the laboratory and the Sentinel sites, analyzing and reporting data, preparing and disseminating surveillance reports, for example, on a weekly basis, assuring that external reports such as FluID and FluNet are complete, accurate, and submitted in a timely manner, and finally, disseminating public health alerts, including those regarding events of national or international significance. The laboratory is central to the entire system. Its role is to test and report. The responsibilities of the laboratory include processing specimens on a timely basis. In some cases, the lab may actually provide supplies for specimen collection, and in all cases, the laboratory will provide guidance to the sites for specimen collection. The laboratory is also responsible for sending influenza viruses to other laboratories when necessary, for standardizing testing, for overseeing quality control, for confirming that biosafety standards for handling and transportation of specimens are being followed, for communicating results of testing to the surveillance site and to the Ministry of Health, for collecting data, ensuring that the data that are collected are complete, for reporting on sample quality, and for assuring that virological results are reported as required through FluNet or other system. In this video, we have reviewed the different levels of the surveillance system for Sentinel respiratory virus surveillance. We've looked at the roles of the different parts of the system. We have looked at the responsibilities of the different parts of the system. We have also looked at the importance of collaboration and the importance of communication among the different parts of the system.